Jonathan Dutton. I'm professor and vice chair at the Department of Ophthalmology at the University of North Carolina at Chapel Hill. There are books on radiology, but they're for radiologists. There was really nothing out there for the ophthalmologist, which is a totally different level of understanding. So I had to learn all of this for myself to interpret films, and so my colleagues would probably be interested in this as well. So I wrote it for the ophthalmologist. The first half of the book is really hundreds, several thousand illustrations, section by section through the orbit in different directions, identifying structures. So you see something on a film, what is this? I've never seen it before. You can find it easily. And the second half of the book is diseases. What does it look like on a CT? What does it look like on an MRI? Something about the clinical relevance to radiology. So it's a kind of a one-place source for radiology information for ophthalmologists and oculoplastic surgeons who need that information without having to go to their radiology department to have them interpret things. A good part of the book is the mechanics of how do you take, what is a CT scan, MRI scan, how is it obtained. I think you really need to understand the physics behind it to understand what the image is. How did it get that way? Then I said the second section is identifying structures, and the third section is the diseases. I've had some feedback, a lot of feedback from people who tell me they like the disease part because it's easy to understand and they get the basics of what they really have to understand. Yeah, that's an interesting project. That's the Atlas of Orbital Anatomy. There wasn't really very much on orbital anatomy. There were a few small texts, but they weren't very detailed. Most books on anatomy, if you look at the sections, it's a jumble of everything together. Arteries, veins, bones, muscles, everything is kind of jumbled in the picture, and it's very hard to understand what the anatomy really is. The original concept of this book was to take human orbits, do fine histologic sections. Then what I did was project them and isolate all of the anatomic structures. So we have a set of transparent mylar sheets, 150 through the orbit, one just with the arteries, one just with the veins, muscles, nerves, bones. Everything is separated. And we were originally going to digitize this in a computer reconstruction so that people could pull up the image, rotate it around, look at it from every... Technology wasn't very good back in 1994 to do that. The American Academy of Ophthalmology put up the funding. It was the most expensive education project they had ever funded up to that date. It just didn't work well. So instead, since they were on transparent sheets, you could hold them up to the light and you had basically a 3D picture of each system. So we had an artist, and I've been lucky enough to have a wonderful artist who's done a number of books with me, who then reconstructed these. So the book is laid out, there's a chapter on arteries. All you see is the arteries. From the front, from the side, from the top, rotating around. Then we add bones, then we add muscles, one system at a time. So it's much easier to understand it when you can dissect out the individual systems and not have everything jumbled together. So that was the concept and worked very well. People were very happy with that. The second edition really updates all the anatomical data that's been published for the past 15 years. A lot of new illustrations that we drew to add into it. Everyone, even experts in ENT, neurosurgery, plastic surgery, anybody who gets anywhere near the orbit. The orbit is a funny thing. It's packed with fat. So even though it's very complicated anatomy, if you go into the orbit every day, you still don't see the anatomy because everything is covered with fat. Even structures that you know are there, you can't see usually. So you have to know in here where things are and what their relationships are. So that's the importance of it. So what the book is designed to do is to create what's called an eidetic image. An eidetic image is a mental image. So if you want to visualize the anatomy, let's say you have a patient with a tumor and you want to kind of understand where it is, it's an eidetic image is like having a photograph in front of you, only that photograph is stored in your brain. And this this way it's presented in this book is designed to help you create these visual images. So you don't have to memorize this connects to that, this connects to this. You just pull up this image and there you see it. It's like looking at a picture in a book, but it's all in your head.